Hello, everybody. Good afternoon, good evening. This is Dr. Shiraz Farooq and Sydney Farooq.
Hi, how are you doing this evening?
Good afternoon again. Good evening also.
If you haven't joined us before, this is our favorite time of the week, Thursdays at 7 p.m.
DaBootyDoc Talk.
Yes, indeed. So if you haven't seen our show, then you are missing out. We're here to give you some education, some fun, a little discussion.
And some humor.
Humor, of course.
Laughter is the best medicine, guys.
Yes, it even can cure your bottom. So
totally does that all the time. So as a board certified colorectal surgeon practicing in Tampa, the DaBootyDoc Talk is held at the offices of Colowell America. That is our surgical practice. Sydney is my spouse. We're here together to talk and entertain you and give out some information, some pearls.
Pearls, little pearls for you today. Oh, I need a pearl necklace. Well, today's discussion, it's episode 29.
Correct.
Are we like at the end of the year?
No, but we are getting there. I mean, this is the end of the year coming up. This is almost Halloween season, guys.
Ooh, spooky.
Spooky, boo.
So to scare you a little bit today, we're going to talk about the pelvic floor.
Elvis is coming out of his grave to talk to us today.
Elvis the pelvis, you know?
Yes. We did a little intro on pelvic health in the past. This is a further discussion on the pelvic health because I believe this is a very important topic. And everybody has a pelvis.
That's right. And some of you know how to use it.
Dance as much as you can because that's one way to use your pelvis.
But the pelvic floor, what is that? I mean, I never really knew much about it. I don't think much about that part of your body unless you're like having a baby or something, right?
Exactly. So pelvis lies between the chest and the legs and the belly. It's the middle part, the lower part where the hips are, where the buttocks are, where you have your urinary and fecal organs. Okay, the butt and the gut meet together in that area where the poo-poo and the pee-pee happens.
I like that, the butt and the gut meet. So it's that big bone that you have in there near your hips that kind of makes it that pelvic region.
You can actually feel that bone. It's on the side.
Feel it.
And you can feel the outer edge of that bone. This is the pelvis. And the floor of the pelvis is made up of muscles. And think of it like a basket that's holding the bowels inside. So when you walk around, this basket is holding your internal organs. Otherwise, they'll fall out. And you'll be like, whoa, what happened here?
Is true, actually. You got to think about it. I mean, we're just a big basket full of organs here.
Correct.
Even your pelvis has organs within it. I think your bladder and your
uterus and your ovaries or your seminal vesicles or the prostate, they hang out there together.
And that's why they need these very large protective bones around them too.
Correct. Those bones help to protect these vital organs. And that's where the sacral chakra is, guys. That's where all the oomph happens.
Yeah. Right, from the pelvis.
Yes. So the pelvis is a very important part because this pelvis allows us to move and stand up, and it is the organ and the part of the body that allowed us to become mammals and walk out of the ocean and climb up and walk in a straight line.
And I mentioned the pelvis as a bone, but that's kind of how I always thought about it. Not really
it's actually made up of multiple bones and has muscles all around it with ligaments and nerves and everything's in it.
So my idea was always this very, simplistic idea, but there's a lot going on in the pelvic floor area.
And the floor of the pelvis, the basket, the bottom part is made up of muscles and skin and ligaments. And that's what keeps us together. And that's very important because if that's not working, then you have a lot of issues.
So you actually have to work out your pelvic muscles. And that's what's important about our discussion today. Because you want pelvic muscles, if you know what I mean. So to keep that basket, keeping everything together over time, you got a lot of wear and tear going on. You have all that pressure from your body, all those organs sitting on top of it. So if you're not conscientious of your pelvic floor, then you might need some therapy later on down the road.
Correct. And pelvic floor therapy is very important and part of pelvic health, how to improve that. And we then come to the part about why does this happen? Why do you have problems?
So there are problems you can have with the pelvis and its amenities.
And the problems are happening in the organs that are there. There's the bladder, so you could have problems with the bladder. So you could have difficulty peeing. You could pee too much, or you could not pee at all. So you could have difficulty there. You can have problems with your bowels. Similarly, you can poop a lot, like Sir Poop a lot. or you could have incontinence where you really, really poop a doop a lot.
So if you're not sure, like, all right, now you just became aware of this pelvic floor we're talking about here. If you have these types of problems, then you might have some pelvic floor issues.
Correct. Bowel issues include leakage of poop and air and liquid, where you cannot hold it, and it comes out without you knowing about it, and you can soil your underwear or your pants or your bed.
This is a problem I'm pretty sure you'll know that you have.
I think everybody goes through it when they are born. As a kid, they have diapers and stuff, and they poop out. So we see
Babies
that.
have fecal incontinence.
There you are actually true, because their sphincters are not very developed.
Right.
So at that point, they will just poop out. So as they grow, the sphincters complex gets bigger and bigger and gets healthier.
Now, adults, you don't have that same excuse.
You do, actually. With the extreme ages, that can happen mostly. So as you get older, you may have to wear a diaper again. And that's what happens. Back in time.
So you might have incontinence issues, you mentioned. That would be like there's, maybe because your pelvic floor is falling, so you don't have that strength there. It's putting pressure on some of your organs that didn't have pressure on them before. So maybe something's pushing up against your bladder. It's causing you to have maybe even urgency where you need to go to the bathroom all the time and you don't understand why. Or maybe you're trying to hold it and you can't. So
right. And also you may have difficulty evacuating if the prostate is too big and you can't pee it out, so you'll have difficulty there.
Right.
Similarly, your organs can fall out. You can have what's called prolapse. So in the basket, if there's a hole, things will start to fall out. So you could drop an apple, you could drop an orange, or you could drop your bladder, you could drop your small intestine or your colon or rectum.
Now, this is a chronic issue that you would have awareness of. You're not just going to drop an apple all of a sudden.
Oops.
But prolapsing organs
can happen with the basket not working, or basket being weak, or having holes in the basket.
Right.
So those are issues that can be developed. And then there are other issues with the pelvis where it can become fixed or immobile, and those are bony issues of the pelvis. So you can have arthritis and other issues also. So
that might
can
cause
happen.
you. Could that cause you incontinence issues, or?
It can cause all kinds of issues. It can cause movement issues, etc. So you know.
And I was talking about like your bladder and urinary incontinence, but there's fecal incontinence too, which he mentioned, because that's where, what'd you say, the poo-poo and the pee-pee meet?
Yeah, so the poo-poo and the pee-pee can have problems.
So you might, similarly, there might be pressure on your bowels that's causing you to have difficulty going, or you could have
inflammation there, or tumor, or something else that could cause an abnormality.
Don't say tumor, we're not even talking about that.
Yes, colorectal cancer can also cause fecal incontinence, can also cause issues.
So if you have a mass in your pelvic region,
or a mass inside the anus that's causing damage to the muscles, you can leak poop also. So those are things that we have to look out for.
So these are some things that might bring awareness to the fact that you might require some pelvic floor therapy of some kind, some sort of treatment. So what are some of the symptoms?
Some of the symptoms would be that you would leak into your pants. You could leak urine, you could leak stool, you can have irritation, you can have a rash in that area.
Do you get like tract infections, or?
Yes, you can get urinary tract infections and other things. So those are all things that you will be noticing. These happen in sometimes during pregnancy, as the baby is being born and held there. It's occupying space like an alien inside us, and that human being is being nurtured and is taking up space. So the basket becomes tighter. So when the baby is born through the birth canal, the canal gets weaker. So in some ladies, if they have had a very large baby, or they've had to do an episiotomy where they cut into the vagina, the muscles can get ruptured, or we have a nerve damage that can happen. So you can have difficulty there. Similarly, extremes of age, as you know, pelvic issues can happen in the elderly patients a lot. The muscles get weak.
Because they're not working their pelvis anymore. They're sitting down in a chair half the day.
Chronic constipation issues where you're not able to poop a lot and your bowels are very hard like rocks, and these rocks collect inside the rectum and the anus, and when you try to push them out, you have to apply a lot of pressure. So that pressure would cause weakening of the muscles, and that can cause issues.
So even things like he's talking about muscle weakness caused to, you know, chronic conditions, even like smoking, you have chronic cough or
yeah, those are very big issues. Chronic smokers have pelvic issues where they can leak urine if they sneeze or cough,
right.
And sometimes they can also leak stool and poop. So that's important. Obesity is another big one, guys. I don't know if you guys know that as you get heavier and your body's mass increases, your muscles have to carry a lot more, so that basket has a lot more weight in it.
Right, when you're gaining fat, you're not gaining muscle, so you're putting extremes on those.
So that fat is accumulating inside the belly, and then it's causing pressure on the muscles, and the muscles over time will thin out.
Doesn't fat grow on the inside, like around your organs, but also outside too?
Yes, so there is visceral fat, which is around the organs, and then there is parietal fat, which is outside the body.
Under the skin, but
under the skin, yes.
But not beyond the muscular layer.
Correct.
So think about that too. You got like your organ you're working with. You're unhealthy. If you're obese, then you're
going to have problems.
Yeah.
Similarly, menopause is another issue where hormonal changes.
These are all women's problems.
Why are the men also? The men can also get menopause-like symptoms and testosterone issues, and they can also have similar problems.
That women suffer more from pelvic floor damage or
because the ovaries have a big role to play, because the uterine hormones, estrogen and progesterone, are not present at menopause, and these hormones are very important for the health of the pelvic floor.
What about medications? Like if I'm taking
So there are certain medications that can cause chronic constipation or chronic diarrhea, and those excessive bowel movements or pressure due to constipation can cause pelvic floor disorders and abnormalities.
I want us to do a study on how much pressure actually builds up in your system when you're like sitting on the toilet for 10 minutes.
There are studies. I would have to go into esoteric journals to find it.
Because you got to think about your body weight, you're pushing. We have a lot of force that we can exert using our bodies.
Believe me, there's been PhDs done on that. I'm sure.
I need to go get a PhD, obviously.
So another thing that can happen is that family history of some disorders, connective tissue problems in some patients can also pass on. And if you have a family member with pelvic floor prolapse or disorder, maybe that may be genetically linked also. So those are some of the common, I think, denominators we have for pelvic floor, why you get it, you know.
Are the disorders of the tissue like specific disorders, or is that just?
Yes. There are certain collagen and elastic disorders that can cause problems like that.
So that wouldn't be isolated maybe to the pelvic region, but throughout
the body,
but it would effectively
issues and connective tissue disorders.
Mm-hmm. So sounds like I need to work out, and we're talking about working out my pelvis.
Yes. So Elvis the pelvis did a lot to work out. And this sounds like a nursery rhyme or a bedtime story, but pelvic floor muscle exercise is very, very important. And actually, we call it the exercise of the pelvic floor. It's been established and it's been around for thousands of years in form of yoga. The ancient monks, Tibetan monks, always also do that. The 5 Tibetan rites exercises about that. In the Japanese culture, the sumo wrestlers also do squats and pelvic floor therapy. They're able to actually exercise their testicular muscles and pull their testes up inside their pelvis when they're about to go into a fight.
This I didn't
Did you know that?
No, I
National
just
Geographic.
they just wear weird diapers.
Yes, but this was in National Geographic's article that I read like 20 years ago.
10 minutes ago. I'm just kidding.
As a kid.
Weird stories about the pelvis.
Yes.
We need to start Googling the weird stories about our topics before.
That muscle is called the dartos muscle, DARTOS.
It's not a pelvic muscle? Oh, the testicular.
It's part of it, so it can pull the testes up, and in some animals, that's a defense mechanism.
And humans mastered that one too.
In some cases, yes. The sumo wrestlers have done that. Hiya! Apart from that,
Be watching some sumo tonight.
correct.
So okay, now we got a problem. I gotta work it out.
So working out is so important.
But what's this exercise you're talking about? Does that have a name?
So the exercise
You
is
mentioned
called,
like a bunch of different people doing different exercises.
So-
Are they all
so
doing
the-
the same thing?
So the exercise has been called many names, and they also called pelvic floor therapy. Kegel exercise is another word for it. KEGEL. And what these are basically exercises where your anal sphincter muscles, your bladder sphincter muscles, your urethral muscles are working to stop the pee or let you pee, or stop the poo and let you poo. So these muscles in the front and the back, look at it like that. It's like that. These muscles are together and they're intertwined into each
My
other.
little basket.
And that basket is holding everything. So these muscles can work together. And if you are practicing them, and that means that you practice them by holding your pee, that mechanism is if you're in the bathroom and you're trying to pee, and if you try to squeeze your muscles, you know exactly what I mean. Similarly, if you're
Like
trying to stop. So similarly, if you're in a situation where you don't want to pass gas, or you don't have to poop, you can squeeze your anal muscles. And that action comes from the mind down to the bottom, travels through the spinal cord.
Amazing.
So that reflex can be controlled. And that is the exercise that we teach and we educate patients about, that if you consciously, with your mind, over body, do that, you can improve your pelvic floor. You too can be very healthy.
Have you ever taught your body to do any cool tricks? Like, can you like wiggle your toe or something?
I haven't, but I know people who can wiggle their ears, they can wiggle their nose and eyebrows sometimes, and I know people, the ancient Hindu, as part of the yoga technique, can actually lift buckets of water with their penile muscle. So this is also known as a pelvic floor exercise. So the Hindus have been doing it, the Chinese have been doing it, the Japanese have been doing it.
We do not recommend that you
don't
do
do
this.
But as you see, I have been interested in the pelvic floor for a while.
He knows what he's talking about.
Thank you very much. A little bit, not a lot.
No, give yourself a little more credit.
I still have a lot to learn.
This is true. We all do. And therapy and education is always changing. That's why we want to bring these conversations to the floor.
So the pelvic floor exercise is very important. Another way to do pelvic floor exercise is where you, as I was telling you, get your mind to work with your body.
Yes. So that was the point I was making, is that, have you ever taught yourself to do a cool trick? Like, can you do like the ooh, cool?
I tried that, and I can't do the Spock hand. I don't
See,
know.
you can't do it.
I
But
can't.
I couldn't do it either. And I taught myself over time.
So biofeedback is where you can teach your pelvic floor muscles to nano.
Nano.
Okay, yes, nano was the symbol of that.
That's what it's called.
Yes, so the
Okay.
pelvic floor muscles can be taught. So your mind can be trained with biofeedback facilities where you can give signals that can be on the skin and various parts of the body that can do that.
So you develop like mental triggers that cause a physiological response.
Correct, and you can be trained how to do that, and there are physiotherapists out there who help with that. So pelvic floor therapy physiotherapists are specialized in training and helping with that. Then there is something electrical,
Very cool.
very shocking. Okay, you have something like a TENS unit that can stimulate the muscles.
So it's something that makes your muscle contract and convulse.
Convulse and contract, and that causes the sphincter muscles to hypertrophy, grow, and sometimes work better.
Right.
So that has been used in surgical techniques also, and has been used in non-surgical techniques.
So that'd be like a little device that has electromagnetic energy that's controlled by an external remote.
Correct.
And it gets implanted usually into one of your nerves.
But you can have non-operative treatment also, where you can have a pad that
you could wear it.
or you could have something inserted inside also,
right.
which is not very pleasurable.
And it's not like any different than getting the microchip we already have. So
yes, we all are robots.
but that's very non-invasive, has a lot of success rate.
Another very important and very new non-invasive technique that has come out is called the Emsella Kegel chair.
Oh yes.
So this is something that uses high frequency magnetic energy, and what it does is that you sit on this chair and it gives you these beams of energy. It's like whoa.
This is some space age technology,
yeah,
guys.
Beam me up, Scotty. I think our engineer up there, because he's not here anymore, his ashes are up in the sky somewhere because it went with a satellite.
Talking about the guy that beamed Scotty up?
Scotty up, yeah. So Scotty helped develop the in Star Trek, developed the electromagnetic warp drive. Am I making it up? Probably not. So a localized version of the warp drive is this electromagnetic chair that you sit on with your clothes fully on.
I've done it.
And what it does is that it gives electrical magnetic energy that stimulates the muscles to contract. You do it for 30 minutes, you get off, you do it 2 times a week for 3 weeks.
What's awesome about it is we mentioned Kegel exercises and some other therapies that would kind of replicate the same thing, but these aren't easy to do in the quantity that you need to. You have to be like...
You can do 10,000 Kegels in half an hour?
I couldn't do that many in maybe a year.
Maybe in a lifetime.
Nor would I catch myself.
I don't think anybody can do that many in a lifetime.
So instead of having to train your body with biofeedback or some sort of therapy where someone's sticking a finger up your...
Or a machine up
and telling you when to squeeze and how to squeeze properly, you have to actually learn how to make your body do these things. So the Emsella chair that he's mentioning, you sit on, fully clothed, and then you receive the electromagnetic energy in the right spot where it's contracting, convulsing your muscles.
And that seems to help the pelvic floor. It gives about between 11 to 12,000 Kegel exercises in 30 minutes.
And that's what's key.
And that's the key, that when I hear about this, my mind is blown, because I believe this is a very important tool in patients who need to be evaluated for surgery. So if you have a patient who needs surgery for bladder issues, or has urinary incontinence, or has bowel incontinence and needs a sacral nerve implant or a bowel surgery or anorectal surgery, and these patients have these issues, you all tell them, hey, go do some Kegel exercises, go do some physiotherapy.
Right.
Your grandma is not going to do Kegel exercises. Let me tell you, your grandfather is not going to do
Or if you're not doing it properly, it's not going to help you to the extent that it needs to.
And they're not doing 12,000 Kegels.
No way.
So I think this is a very good modality which will improve and will be very popular in the future. So this is a technology that has a great future.
It fills a big void. So you have your very simple, non-invasive techniques for treatments, but real quickly you jump to surgery because there's nothing in between. It's exercise, do some mild therapies, but then you're a candidate for surgery next.
Hold on. Before you go to surgery, you also have to change your diet, guys. This is something I have to bring up because
I'm going to talk about that.
I was going to tell you about it. Preventative treatment, guys. Fiber is so important for your colon. It is so important for your bowels. It's also important for your bladder.
Not forget.
What happens is that if you're constipated or you have severe diarrhea, and if you don't take fiber, you are going to have a difficult time because you'll have to push a lot, and that will weaken your pelvic floor. Whether you have urinary incontinence, whether you have fecal incontinence, fiber seems to help. So eating extra fiber in your diet adding supplemental fibrous tissue or fibrous foods will make your pelvic health better.
I just picture people like, does this have fiber in it?
Everybody should be
Eating
talking about
things.
fiber. Apples have fiber.
I meant non-food items, because you told me to eat some fibrous tissues. So.
not a tissue box.
Remember,
Well, the tissue
you
box
are what you eat.
Yes.
So
eat more
More
fiber,
fiber.
more fruits, more vegetables, and that will help your pelvic health.
yes.
And then comes surgery.
And again, these are more preventative things. So like things you need to be conscientious of throughout your life, not
Yes.
just when you find out that your orange just fell out of your
That's
pelvic
it.
region.
So for people who are passing oranges or apples and cannot fix their basket, you will go to a surgeon who can fix the front or the back or both together. So that
But-
means
The modality of the electromagnetic chair.
can improve and can improve the symptoms so that the milder patients may not become progressively worse and get surgery, or can downgrade some patients, or can be used prior to surgery as a preoperative tool to increase and strengthen the muscle.
Right.
So that muscle doesn't heal easily. It heals by scarring. So if you are going to be having patients that have surgery on their pelvis, you want to improve their pelvic health and give them physiotherapy.
Right.
And physiotherapy takes 12 weeks or longer. Kegel exercises on the MCella may take 3 weeks. So that is something that is a big tool for a urologist, a gynecologist, for a proctologist and colorectal surgeons, general surgeons, and some GIs. So it's an important tool for all of us to be aware of and to know about.
Yeah, so and technology's always growing, developing, changing. This technology's been around a few years now. Sacral nerve stimulation, how long has that been around?
That's been around for 10 to 20 years.
That can be very effective too.
So the next step is surgery, guys, where you may have to implant a device inside the back that will go to the nerves and will give electrical current and will improve fecal incontinence and urinary incontinence. There are surgeries that can be done where you can repair the bladder, you can repair the colon or the rectum through the robot, through laparoscopic surgery, or through open operations, or going through the bottom, through the...
Drop a robot in there.
You have robots for that too.
Surgery can be
Dangerous
though.
It can cause bleeding, it can cause infections, it can cause
Might not fix the
damage,
problem completely,
or it
might
may
make it
cause
worse.
problems. Yeah. So there's a lot of things that everybody should be weighing into before they jump into the surgical theater.
Right.
So diet,
Yeah.
exercise,
What do we
everybody
need
talks
to do?
about. Fiber, do some squats, do some leg raises, pelvic floor jumping jacks.
Look up pelvic floor therapy if you think you have any of these problems.
And I think Kegel exercises should be taught to everybody over the age of 50. Okay? When you're in your 50s and you're having
anyone that had a baby
and you're having problems with urination or bladder or bowels, we should teach them what a Kegel exercise is so that when you're watching TV and there's a commercial on the TV about depends, yes.
you don't fall into that category.
You could be doing Kegel exercises too.
Yeah, and it's important if you're having issues now, whatever stage you are in life, imagine down the road. It's only going to worsen.
So the muscles don't get stronger until you exercise them. So if your biceps are not healing or not improving, that means you got to pump iron. In the same way, pelvic health gets better when you exercise.
So put on some Elvis.
And do the pelvic stance. Guys, this is the end of this talk today. We covered a lot in pelvic health, ranging from diet, prevention, surgery, and in between, what are the different tools, including the MCella chair, which is a unique new machine that's out there. There's also old-fashioned biofeedback and physical therapy that is still around and still helpful.
These things work.
And they all work together.
Right.
So please consult with your physicians and your experts and make a comprehensive plan as to how you are going to get better and be able to dance like Elvis.
Thanks again for joining us with DaBootyDoc Talk in Tampa, Florida at Colwell, America. We'll see you just a week from now, so don't worry, we'll miss you too. And if you have any comments or anything you want to add, questions, thank you everyone for joining today. We'll be happy to talk to you.
Thank you, everybody. Have a good night. Bye-bye.
Bye.
Thank you.